If you have ever wondered what a clinical child psychologist does, then you are at the right place. Clinical child psychology is the branch of psychology that deals with children and adolescents in a therapeutic settings. Clinical child psychologists work with children and their families who experience mental health issues. Clinical child psychologists help children with language development disorder such as stuttering or delayed speech by working with parents and caregivers. Clinical child psychology is a wide field that studies the normal growth and development of kids. Clinical child psychologists are responsible for observing, analyzing, diagnosing, and treating children with psychological problems. A clinical child psychologist has a wide scope of activities. Their responsibility can involve working with individuals, families, and groups to help promote, restore, and maintain healthy and emotional, educational behavioral development in children or teenagers. This field of psychology deals with mental health, abuse, neglect, family problems, and other things related to kids. If you are thinking about becoming a child psychologist, you can surely consider this field. Clinical child psychologists work in a variety of settings such as schools, private practice, colleges, and universities. Clinical child psychologists are also responsible for carrying out psychological evaluation to determine if an individual has cognitive development disability. They may also help individuals improve their adjustment to life, challenges with grieving, loss, school problems, or parental issues as well. This field provides therapies to both children and their parents. So basically, clinical child and adolescent psychology is the branch of psychiatric science that deals with the prevention, diagnosis, treatment, and mental health for children. With no doubts, it is a difficult job because kids are unpredictable, but it can be rewarding to help them through their struggles. With your results about the children, it is worth the investment. So basically, a clinical child psychologist specializes in preventing, diagnosing, treating psychological problems as well as mental health and behavioral health. Clinical child psychology is a sub-branch of psychology. With the right treatment plan, most children can overcome their obstacles with help from an experienced professional who understand how to best meet their needs. When it comes to complicated cases involving trauma or abuse, you can expect clinical child psychologists to work with other support systems as well to provide the best service for your child. Clinical child psychologists are trained in science-based methods of treating their patients. Clinical child psychologists also spend time in learning about what works and what does not, so you can expect that the treatment will be highly effective. The treatment plan is not based on assumptions, opinions, or judgments. It focuses on observing, analyzing, and treating the problem with right treatment. They will not just tell you what you want to hear, but rather give results based on scientific studies and control experiments as well. A clinical child psychologist gets to understand their patients better, and this allows them to develop understanding and rapport with their clients, which build up trust between them. So you can expect that your child's clinical child psychologist will have good people skills and will help your kid learn a lot.